Hello and welcome to our community group project presentation on substance use, specifically fentanyl addiction, by Noon Lee, Sienna Vasquez, Samantha Montanez, Megan Farrell, and Tara Smith.
What is fentanyl? Fentanyl is a powerful opioid that can inhibit pain signals in multiple pathways along the brain and spinal cord. It is used to treat patients with severe pain or to manage pain after surgery. It is similar to morphine and heroin in how it works. However, it is a lot more potent. Fentanyl comes in many forms, including pills, powder, liquid, sprays, and transdermal patches. It is swallowed, smoked, snorted, or injected, and it is commonly found mixed with other drugs like heroin, cocaine, and methamphetamine. Some common street names for fentanyl are Dragon's Breath, Crazy One, Goodfella, and Dance Fever. If misused, fentanyl can cause a person to stop breathing completely, leading to death. Buying fentanyl from the street can be dangerous because it is commonly mixed with other drugs such as heroin and cocaine. It can cause short or long-term health problems, which can lead to mental health issues, causing even more complications. It is about 100 times more powerful than morphine and about 50 times more powerful than heroin. Even a small amount can cause an overdose and/or death. If a person were to overdose on fentanyl, they should be treated immediately.
A person who is addicted to fentanyl might exhibit certain signs and symptoms. For example, they might have constricted pupils. That means their pupil size are smaller than normal. You might notice a noticeable elation or euphoria. They might have persistent drowsiness or sedation. That means they're sleeping longer than usual or at strange times. They might have confusion or mental fog, which includes difficulty focusing or trying to keep track of important information. They might have constipation. That's because opioid drugs cause stool hardening or constipation. They might have slowed breathing, and that's because opioids slow respirations. And they can also nod off or lose consciousness. Again, this could be falling asleep in the middle of a conversation or passing out. A person who has fentanyl addiction also exhibits behavioral signs, such as having money shortages or financial problems. That's because fentanyl is a very expensive drug, and so that can contribute to their financial problems because they're spending all their money on the drug. They might also do what's called doctor shopping. It's where they go to many different doctors to try to get them prescribed fentanyl. And then they also do what's called pharmacy shopping. It's kind of like doctor shopping, but instead they'll go to different pharmacies and try to get that order filled so that they'll have a lot of that drug. They might also exhibit mood swings and irritability, and this is a common behavior for addicts, and that's because they get very defensive and they try to hide their addiction. And when they get questioned about it, that contributes to their irritability and mood swings. They might also become socially withdrawn and isolated, and that's because they want to hide their addiction from their family and friends. So instead of seeing them, they'll just be alone so that they can continue with their addiction and drug use.
Criminal drug networks are mass-producing fake pills and falsely marketing them as legitimate prescription pills, or even lacing other drugs to deceive the American public. In 2021, more than 71,000 people died from synthetic opioid-related drug overdose in the United States, according to the provisional data from the Centers for Disease Control and Prevention. Based on the preliminary 2021 data, there were 6,843 opioid-related overdose deaths in California. 5,722 of these deaths were related to fentanyl. From quarter 1, 2019 to quarter 3, 2022, fentanyl overdose deaths have increased by 365%. As a part of the One Pill Can Kill initiative, the Drug Enforcement Administration and its law enforcement partners seized more than 10.2 million fentanyl pills and approximately 980 pounds of fentanyl powder during the period of May 23 through September 8, 2022. The amount of fentanyl taken off the streets during the surge is equivalent to more than 36 million lethal doses of fentanyl. Drug traffickers have expanded their inventory to sell fentanyl in a variety of bright colors, shapes, and sizes. Rainbow fentanyl was first reported to the DEA in February 2022, and it has now been seized in almost 21 states. Of the 390 cases investigated by the DEA during the May 23 through September 8, 2022 period, 129 cases are linked to social media platforms, including Snapchat, Facebook Messenger, Instagram, and TikTok. Drug dealers are deceiving their customers by making counterfeit pills look like prescription opioids, such as oxycodone, hydrocodone, and stimulants like amphetamines. Fake prescription pills are easily accessible and often sold on social media and e-commerce platforms, making them available to anyone with a smartphone, including minors. Half of all fentanyl-related deaths in San Joaquin County since 2019 have occurred in people ages 14 and 35 years old. The only safe medications are ones that come from licensed and accredited medical professionals. DEA warns that pills purchased outside of the licensed pharmacy are illegal, dangerous, and potentially lethal.
What to do if you think someone is overdosing. It may be hard to tell whether a person is high or experiencing an overdose. If you aren't sure, treat it like an overdose. You could save a life. Step 1. Stop what you're doing and call 911 immediately. Step 2. Administer naloxone if available. Step 3. Try to keep the person awake and breathing. Step 4. Lay the person on their side to prevent choking. You will use their hand to support their head, and you will use their knee to stop the body from rolling onto their stomach. I attached a picture to the right for reference. Step 5. Stay with the person until emergency assistant arrives. Life-saving naloxone. What is naloxone? Naloxone is a life-saving medication that reverses an overdose from opioid, including heroin, fentanyl, and prescription opioid medication when given in time. Naloxone is easy to use and small to carry. There are 2 forms of naloxone that anyone can use without medical training or authorization: the pre-filled nasal spray and injectable, which can be given into a muscle or under the skin. How does it work? Naloxone quickly reverses an overdose by blocking the effect of opioids. It can restore normal breathing within 2 to 3 minutes in a person whose breath has slowed or even stopped as a result of an opioid overdose. More than 1 dose of naloxone may be required when stronger opioids like fentanyl are involved. How to administer it. Take the nasal spray out of the box. Hold the nasal spray with your thumb on the bottom of the plunger and your first and middle fingers on either side of the nozzle. I attached a picture to the left for reference. You're going to tilt the person's head back and provide support under the neck with your hand. Gently insert the tip of the nozzle into one nostril until your fingers on either side of the nozzle are against the bottom of the person's nose. Press the plunger firmly to give the dose of naloxone. Remove the nasal spray from the nostril after giving the dose. You're going to wait and watch the person closely. If the person does not respond in 2 minutes, repeat the step and give the second dose of naloxone. Will it harm someone if they are overdosing? No. Naloxone won't harm someone if they're overdosing, so it's always best to use it if you think someone is overdosing. If you give someone naloxone, stay with them until emergency help arrives or for at least 4 hours to make sure their breathing returns to normal. Anyone can carry naloxone, give it to someone experiencing an overdose, and potentially save a life. Naloxone is available in all 50 states. If you have been prescribed high-dose opioids, talk to your doctor about co-prescribing naloxone. However, in most states, you can get naloxone at your local pharmacy without a prescription.
Treatment options for fentanyl addiction. Professional medical supervision is highly advised during the detox process. This helps to ease the withdrawal, reduces the risk of relapse, and allows for medical intervention if needed. Just having medical staff around to ensure that the detox process is being completed safely and correctly is really helpful, and they can also ensure that the person is medically stable. They can also offer medications that are going to help ease the symptoms of withdrawal. Some of these include methadone, buprenorphine, and lofexidine hydrochloride. Lofexidine hydrochloride is the most recent one to be approved by the FDA. It was approved in 2018, and it's different from the other two in that it is a non-opioid treatment option, and it has been shown to be very helpful in reducing the withdrawal symptoms. Some facilities will opt for the tapering method over cold turkey. Just gradually decreasing the dose will allow the body to adjust and make the symptoms of withdrawal a little bit less intense and easier to manage, and thus reducing the risk of relapse. And rehab facilities are very helpful in getting people sober and also helping them to stay sober. Not only do rehab facilities focus on the detox process and helping them through withdrawals, but they also give them important skills and knowledge about their addiction and how to stay sober once they leave their treatment center. Community resources for San Joaquin County. So in San Joaquin County, there are several facilities that assist in the detox process and rehabilitation from chemical dependency. I have a couple listed here, which would be San Joaquin Recovery House. It's located by San Joaquin General Hospital, and it's a residential detoxification center. They offer therapies such as cognitive behavioral therapy, anger management, relapse prevention, and the 12-step facilitation. They accept Medicaid, FSA, private insurance, state-financed health insurance, and self-payment. And then across from Recovery House is Family Ties, and this is a female-only facility, so all the staff is female as well, and it's for women that have gone through the detox process. They're currently sober, and their main focus is developing skills in parenting and sober living. So the priority is given to pregnant women and women with children. They also accept Medicaid, FSA, private insurance, and state-financed health insurance, and also self-payment. And then the last resource is Narcotics Anonymous. There are a lot of Narcotics Anonymous meetings throughout the county. I have a website listed here that shows ones that are near you. And I have one listed, the St. Joseph's Behavioral Health Center one. It's on Thursdays from 7 to 8:30 in the trailer classroom. And NA meetings are a good place to start for somebody that is wanting to get sober, but they're not sure about it, or they don't know where to start or what to do. These are really good environments because there's a sense of community, and the people there want to help. They all have a common goal, and they also have a lot of resources to offer to help a person start their path to recovery. And that concludes our presentation. Thank you for your time.